Thank you very much for the introduction and for giving me the possibility to talk. It's a great honor for me. Septal perforation, the most common cause still worldwide on the world is previous septal surgery. So for that reason, septal perforation is always a big problem for the doctor. To my opinion, a septal perforation is a prototype for numerical simulation, how it can be a helpful tool to understand what an endonasal pathology makes for airflow, for humidity, and also for the temperature within the nose. So as I already told you, the most common cause is still previous septal surgery. The typical symptoms are crusting, nose bleeding, whistling, and difficult nasal breathing, which is a little bit unclear why this happens, because usually they have a big hole, but the patients still have the impression that they suffer from difficult nasal breathing, and the surgical closure is not so easy, especially when the perforation is bigger. And in Germany, we always try to use a 4-bridge flap technique with an interposition, for example, of ear cartilage to close it. And in the literature, the success rate is about 70% to 90%, depending on the follow-up time that the patients were controlled. What we started with in vivo measurements of temperature and humidity within the nose. And what we did is we measured people with a septal perforation and compared them to people without a perforation, and we were able to show that people with a septal perforation have a reduced temperature and humidity profile. If we do surgery and we close successfully the perforation, afterwards we see a good improvement of air temperature and humidity after successful closure of the perforation. But we did not know why this happens. So the reason for crusting and disturbed intranasal air conditioning is unclear. In vivo investigations of the nasal airflow are not possible. And so for that reason, this was the first time how I came into contact to numerical simulation, was a simulation of septal perforation. And you will see that numerical simulation is a helpful tool to understand how an endonasal pathology influences nasal airflow and also therefore influences humidity and temperature within the nose. So what we did is that we reconstructed a nose model, and what we did is that we inserted artificially a septal perforation, and then we did simulate airflow through the nose, and what we were able to show is that there is a very high cross-flow through the perforation, and particles cross from the left to the right side in the area of the perforation. And this leads also to a reduced air temperature in the region of the perforation, but not only the air temperature was reduced, but also the humidity. So you can see that due to changes of airflow, you have a change in the respiratory function of the nose. And this is also very nice, as you can see that the particles, they bump against the posterior edge of the septal perforation, and therefore what you see when you do an examination of the patient with a septal perforation very often, that you see crusting and nose bleeding at the posterior edge of the perforation, and that this could be very good visualized due to the numerical simulation. In another study that I performed with Fabian Sommer, we tried to determine the influence of the site of a septal perforation on intranasal airflow. For that reason, we created 4 realistic nose models with 3 differently localized septal perforations. Numerical simulation was performed with ANSYS and Fluent, and we had some support from the company. the inspiratory airflow patterns were analyzed. And here you can see a model where we created a perforation, which is a typical perforation in the anterior part of the septum, almost in area 2 to 3. As you all know, you can play with the model. And then you can see on the upper left side no perforation, and on the upper right side you can see a very big perforation, which is very typical, and you can see a very high cross flow in that area with high velocities. And on the lower side, on the left side, you can see the perforation which is anterior and higher, and you can see that there is also cross flow, but it's not so fast. And the posterior perforation doesn't really influence the particles through the nose. And here you can see it again. So there is a very high cross flow within the typical septal perforation in the anterior part of the nose, if it's below. And here you can see particles passing the model. And we will see this is a model with the posterior septal perforation, and it takes a little bit time. And then you can see that there are smaller particles coming out at the end of inspiration. So there is not such a high cross flow. This is the perforation anterior and higher. And then you can see that there are only some particles crossing to the other side. And this is a typical perforation, the anterior-inferior perforation. And here you can see a high cross flow with high velocities. And this can very good explain the complaints of the patient. To remember, numerical simulation are really a helpful tool to understand clinical findings, especially in septal perforations. And what septal perforations really explain is a close relationship between nasal airflow and air conditioning within the nose. And a significantly alternated airflow can be found in septal perforations, causing a reduced nasal air conditioning, and the site of the septal perforation really influences disturbances and complaints of the patients. And the anterior-inferior septal perforations is the worst one. As you were able to see, there is a very high cross flow, and what we should try to avoid is making a septal perforation during nasal surgery, especially in the anterior part of the nasal septum. Thank you very much.
Thank you very much. Good presentation. So patient with septal perforation, the most annoying for the patient is making the noise. So now we also did the study. Actually, we try to figure out, because exchange anyway happens, but now we don't know which degree of air exchange can cause the whistle, like noisy. So this is actually the one, because I have seen recently saw one patient, a big perforation, so he feels it's okay, I'm fine. But we saw someone, very small one, patient feel very annoying.
Yeah, that's true. To my opinion, very often the smaller septal perforations, they make more noises than the bigger one. And what we also do is that very big perforations that make complaints, which we are not able to close, we try to enlarge them and make the perforations even bigger to the posterior part of the septum to reduce complaints. Yeah.
But now for our CFD model, are we able to monitor, for instance, the level of exchange, position of exchange, which are correlate to the patient quality of life or something?
A very good question, but we never did it. So, yeah.